Thanks so much, Dr. Gupta, for being with us on the broadcast. You know, it's heartening after the WHO, now the EU Health Authority has also said that the AstraZeneca vaccine, you know, the benefits of the vaccine outweigh the risks. Yet, there are over 20 countries in the world which are seeing a rise in COVID-19 cases but have suspended the vaccine. How do you see this impacting our fight against the pandemic?
Yes, thank you for having me on the show, Rishika. Look, let me just go back to where this all started from. So there were a few isolated cases in Denmark, in Norway, and in Ireland where young people who got the vaccine were seen to have blood clots after getting the vaccine. And after that, there was this absolute, craze of fear that spread across Europe, and then countries started banning it. But let's look at the facts. The WHO did an emergency meeting yesterday. They sat down with health officials from all over the world. They reviewed the data that was there for this vaccine. The European Medical Agency did the same thing. And what they found was that the risk of this vaccine giving you blood clots is actually lower than the risk of getting blood clots in the general population. So I'll give you an example. If any person, say you or me, in the general population has a risk of 1 in 1,000 people of getting the blood clot. So that means 1 in every 1,000 people have a general risk of getting blood clot. The risk in the vaccine is much lower. So only 40 cases, as per the AstraZeneca review, have been known to have blood clots out of 17 million doses given. That is a risk of 0.0002%. compared to a risk of 0.01% in the general population. So the vaccine actually decreases your risk if you look at it in that way. And if you think about coronavirus as a disease, which has now become a thromboembolic disease more than anything else, then you actually have an added risk of getting blood clot with COVID than you do compared to getting the vaccine. So the vaccine would actually protect you from getting those complications.
Well, Dr. Gupta, I think that's very important perspective. When you put that statistic into context, it's extremely important information, especially for viewers here in India and of course, in the UK and all those countries that are using the vaccine. But, look at that graph that we're putting out on our screen at the moment. One graph talks about the COVID trajectory of cases in the EU, and the other graph, in fact, talks about the vaccine trajectory. And if you see, in the last 1 week, there's been a decline in the number of vaccines that have been administered across the EU. Does this worry you? Do you believe that this is a setback to our fight against the pandemic at a time when we're trying to inspire confidence in COVID-19 vaccines and urging more people to take them?
Absolutely. Not only does it worry me, Rishika, it also worries the European Medical Agency, who came out and told countries like Germany, countries like France, both of the countries, including Ireland, which are seeing increase in numbers. They have lockdowns going on, and yet they have suspended the use of this vaccine. Now, we have been using this vaccine in the United Kingdom for the last 2 months. India has been using this vaccine quite extensively, and no cases have been brought up that are of concern or of alarm. And you can see the UK's numbers have gone down drastically in the last 2 months. So the vaccine works. There's no questions about it. The questions on its efficacy and its side effects should not be considered and compared to the benefits that the vaccine gives you.
Yes.
And there's definitely way more benefits than the risk.
Very last question, and I have 10 seconds. All of these countries at the moment say that this is a precautionary measure. Do you believe this move will quickly be undone now that the European Health Authority as well as the WHO have cleared the vaccine?
Well, yes, unless they can bring up some concrete data to show why they are banning the vaccine or stopping it, I think that the WHO and EMA are quite good authorities to make decisions on the fact that the vaccine is safe. And if they have said so, then I would not be worried about getting the vaccine.
All right. Well, thank you so much, Dr. Gupta, for sparing your time and being with us on the broadcast. It is indeed important perspective that you've lent. The vaccine is safe and you can, in fact, go ahead and get yourself vaccinated. We're going to slip into a very short break at the moment. But on the other side, we'll get you a live update from Berlin. How really are people in Europe looking at the temporary suspension of the AstraZeneca vaccine? All the details on the other side. Stay with us.